When there is an emergency in the pre-hospital environment, any member of the community can call 911 and get trained clinicians dispatched to the scene of the emergency within minutes. But emergencies happen in the hospital as well. At HCA Florida, North Florida Hospital, we have a dedicated rapid response team to respond to any emergency that should arise anywhere in the facility. Because when a patient's declining, it's all hands on deck to save their life. Time is of the essence, and the interdisciplinary rapid response team is there to implement rapid interventions to save their life. The role of the rapid response nurse is to jump in and help facilitate rapid interventions for the patient. Every nurse on our team has years of experience in either ICU or ER and are certified in their specialty with their CCRN or CEN. Not only are they skilled to know how to intervene when a patient's crashing, they are also strong leaders who can effectively delegate and direct the team towards a unified effort of saving the patient's life.
The rapid response team also plays a very important role in education. Part of what they do in these instances is to provide education and teaching both before events and after to help facilitate the prevention of patients' decline in the future.
When the bedside nurse discovers a patient has had a change in their condition, they should first assess for any immediate life threats. Is the airway open and patent? Are they having any trouble breathing? How is their circulation? If they do not find any life threats but still need emergent or rapid intervention for the patient, they can activate the rapid response team by calling the codes number in iMobile or by dialing star 55555 from any landline. They can get help from their team members on the floor. The nurse tech will grab a fresh set of vital signs and a blood sugar, and the charge nurse can bring in the crash cart to the room. Once the rapid response nurse arrives, the primary nurse will give a brief history of what led up to the event, the reason for activating the rapid response team, the time the patient was last seen at their baseline, and any recent medications, procedures, or labs that may be relevant. The rapid response nurse will perform a brief assessment of the patient and start preparing for possible interventions. The rapid response team comes to every emergency prepared with devices to ensure we can gain vascular access. They carry a portable ultrasound probe as well as an IO drill, so no matter what the emergency, we can give medications. In addition to the rapid response nurse, the respiratory therapist, ICU resident, or nurse practitioner or PA from the critical care unit are also paged to the bedside of the patient having the emergency. The rapid response nurse will quickly delegate roles and ensure that every position is filled so the whole team can work together to implement interventions for the patient. In this particular scenario, the patient needed to be emergently intubated and could not wait to be transferred to the ICU. The ICU attending would be paged to supervise or perform the intubation.
Hey, Dr. Hobson. Yeah, it looks like a patient here is going to be needed intubated.
In the event that the patient's condition progresses towards cardiac arrest, calling a code blue will activate additional staff resources to help both the patient and the family members. The chaplain responds to the bedside, along with the house supervisor and a pharmacist. Additionally, a phlebotomist and radiology technologist will also come to support the team caring for the patient having an emergency. The chaplain is there to be with the family, and the house supervisor helps to facilitate patient placement in one of our critical care units. Once return of spontaneous circulation is achieved and the patient is made stable for transport, the primary nurse will call report to the ICU, and the rapid response team will transport the patient to the critical care unit. Once care is transferred to the critical care team, the rapid response team returns to the patient's previous room to lead a debrief and provide kudos, to discuss opportunities for improvement and answer any questions the staff may have about the event. This is a great opportunity for education and to promote interdisciplinary collaboration.
I am a huge supporter of the rapid response teams here at North Florida Hospital. They have done an amazing job at improving clinical outcomes for our patients in the ICU by being our eyes and ears outside of the ICUs. They help get patients who are sick to the ICU sooner so that we can treat them sooner and so that their outcomes are improved. They also help us improve the care of those patients who don't need to come to the ICU but that need an intervention so that their care can be improved while they stay outside of the ICU. Our ICUs stay at full capacity and the ability of the rapid response team to help those patients outside of the ICU has been crucial.
I think what is sometimes lost in the title of rapid response is the relationships between the rapid response team and the entire staff, nurses, physicians, and all members of the care team rely on the rapid response team to assess patients before they decline.
The rapid response teams have truly improved care at North Florida Hospital. First, it's improved the consistency in how we respond to codes. Having a dedicated team that responds in a timely manner has truly improved the outcomes of our patients. Secondly, it's improved care in our critical care departments because we're no longer pulling caregivers off the ICU to respond to codes in the rest of the hospital. But finally, I believe we've seen an improvement in care because our consistency of our rapid response team has truly impacted the culture of our med-surg units. They now can better identify patients that are potentially headed in that direction, and as a result of that, they move them to a high level of care, which has reduced the number of codes we've seen in the hospital.
If there's anything that I would want a new team member to know about our rapid response team, it is to feel empowered to call early and call often. The rapid response team exists not only to respond to emergencies, but also to prevent them. We are here for the whole hospital to support the bedside nurses and the patients they care for. So if you have any concern for your patient, even if it's just intuition, know that our team is here to come alongside you as an advocate and to help get your patient what they need to promote the best outcome.